Mark Butler, thanks for your time. 45 Australians lose their lives every week. What's the government doing about this?
Well, these are statistics that we've known for some time. The suicide rate hovers somewhere between 2,000 and 2,200 every year, and tragically we haven't seen that rate come down over more than a decade now. There were certainly some improvements in the late 1990s, but over the last 12 or 13 years the rate has been fairly flat. And that is why we're redoubling the Australian government's efforts in relation to suicide prevention, and we're in the middle of rolling out the biggest ever suicide prevention package around Australia.
Well, let's just go through a couple of the recommendations, 10 in total. First of all, reducing the use of restraint, seclusion and involuntary treatments. Are they being used too much at the moment?
Well, look, this is one of the recommendations that I think the state and territory governments need to look very closely at. There was an agreement in the middle part of the last decade that state governments in the hospitals that they run that include mental health patients in them should look at reducing as far as possible the use of seclusion, so people being locked up in rooms alone, and the use of physical restraints as well. I understand we've seen significant improvement in that area over the last several years to the extent of about a 50% reduction. But what the Commission report says is that not all state governments are reporting transparently on that. The Commonwealth Government has invested significant money into state health systems to see those rates come down, and I think it is a recommendation that state and territory governments should look very closely at to report openly and transparently.
Should it ever be used as a punishment?
Well, look, I'm not a clinician. It should never be used as a punishment, but I'm not a clinician who can give proper advice about whether there are circumstances where restraint in particular, not seclusion so much, but restraint in particular might be an unavoidable clinical decision. But look, all of this should be reported openly and transparently, and that's the important point I think the Commission's report makes today.
Indigenous Australia has been found, as we know again, to be or to have much higher incidence of mental illness and suicide as well. What specifically is the government doing to address that?
Well, this is an area we've been working very hard on over the last 12 or 18 months since the release of last year's mental health reform package. We've rolled out the first of 2 rounds of programs targeting Indigenous communities, particularly for suicide prevention programs that we want to be designed by the communities themselves, because the evidence shows that those are the programs that work best. The second round of about $4.5 million is open now actually, and it closes in the next few weeks. But more broadly, the Menzies School of Health Research up in the NT, along with a range of Aboriginal organisations, are in the process of developing a broader suicide prevention strategy for Aboriginal and Torres Strait Islander people, and we'll be looking very closely at that once that's finished.
Well, this report today has been overshadowed somewhat by the continuing claims on the Prime Minister's past as a lawyer. Why won't Julia Gillard put this matter to rest by answering questions in the Parliament as she did in the news conference yesterday?
Well, she had 10 questions yesterday from Julie Bishop. Question
after question. She referred a lot of the answers to her press conference.
From a trained lawyer, 10 questions with a couple of supplementaries as well. I mean, I'm not sure there's ever been an issue with as little substance attract as many words and as many spoken words as this issue has. The Prime Minister has done 2 marathon press conferences now and exposes herself to question time every day of the sitting weeks, including 10 questions yesterday. Really, it's time that the opposition came up with an allegation of substance and put it to the Prime Minister, or they started to get off their fear and smear onto an issue of real substance that matters to Australians.
Well, the opposition say by referring in her answers in question time to her press conference, she's avoiding the possibility that she might mislead the Parliament, which is much more serious than misleading a room full of journalists.
Well, I'm not sure whether the opposition and Julie Bishop are saying that the Prime Minister shouldn't have done these press conferences. They're extraordinarily long. The entire press gallery of Canberra has the opportunity to ask any question that they want concerning this rather bizarre series of questions that the opposition is trying to raise. The opposition then has 10 questions yesterday. I won't be surprised, I'll be disappointed, but I won't be surprised if again in question time today Julie Bishop runs up the same tired old questions from Tony Abbott's Chief of Staff's folder, instead of getting back to focus on things that really matter to Australians.
Anthony Albanese has slammed Julie Bishop for meeting with Ralph Blewett because he's got no credibility, but at the same time the government used the word of Mr Wilson to defend Julia Gillard over the weekend. Why is that? What's the difference?
Well, I think there's a whole range of contributions that lawyers have made, that people involved in this situation have made, and I think it's appropriate that attention be drawn to all of them. But one does have to ask about the motivations of Julie Bishop meeting with this fellow Blewett. I mean, at least when Malcolm Turnbull met with Godwin Gretsch 2 years ago, he followed it up with a very clear and detailed statement about the circumstances of that meeting, how long it went, what was asked, who else was there, and I think it's time that Julie Bishop did the same.
Mark Butler, thanks for your time.
Thanks very much.